Robotic surgery is beneficial for every patient, but it's the most beneficial for the most complex cases.
Robotic surgery is a minimally invasive surgery that really has replaced traditional laparoscopic surgery. So anything that can be done through small incisions, such as hernia repairs or gallbladder removals, colon resections, other intra-abdominal procedures, can be done now using the robot instead of traditional laparoscopic equipment. The main benefits of robotic surgery over laparoscopic surgery, one of them being the visualization. With traditional laparoscopic surgery, the visualization is a two-dimensional view. So it's kind of like looking at a television screen and trying to operate that way, as opposed to robotic surgery is a three-dimensional view. So the camera that we insert, we look through a special viewfinder and we see a three-dimensional, it's like putting 3D goggles on. So it enhances our view, it enhances the anatomy, allows us to do more fine-tuned and more intricate surgery because of the view. The second main advantage of robotic surgery is the dexterity that comes with it. So with traditional laparoscopic equipment, the instruments that we put in are rigid, what we call straight sticks. So they may have pinchers on them or grafts or hooks, but they're rigid. It's kind of like operating with chopsticks. As opposed to the robotic arms, they have wrists at the end of them. So when I move my wrists to operate, the robotic wrists move as well, correspondingly. And it allows me to do more intricate maneuvers and more complex surgeries within the abdomen and be able to really do procedures that we couldn't do before laparoscopically. The main benefit to patients is that usually the recovery afterwards is improved with the finer maneuvers that we're able to do with the robot. So with the more delicate manipulation of the tissues that we can do with the robotic instruments, there's less postoperative pain, less postoperative swelling, especially when it comes to hernia repairs. Other benefits to the patients are that we're able to do things in the procedure that we couldn't do laparoscopically, such as suturing the mesh in hernia repairs, as opposed to fixating with other methods such as tacks, which can theoretically then reduce the postoperative pain involved with hernia repairs. And really probably the biggest benefit with robotic surgery is that we're now able to do procedures in a minimally invasive fashion that really couldn't be done laparoscopically before. So the options before were open surgery versus laparoscopic, and if you couldn't do it laparoscopically, you had to do it open. Now we're able to do some of those open procedures minimally invasive with the robot, and it allows them to again have significantly improved recovery and return to function as opposed to an open surgery. A lot of my patients that have had robotic surgery have had very minimal postoperative pain and sometimes have not used pain medication at all after surgery. So it allows them to get back to normal function quicker. It get back to normal lifestyle, gets back to work, and really gets them through the recovery process a lot faster than traditional laparoscopic surgery.